Hi, this is Maureen O'Hara, one of the PAs on the ODA service, and I just want to go over the imed consents with you, which I have a feeling you're already familiar with, but I understand from some of the other residents that there are a few things that are just a little bit different. So first of all, you want to click on the E to get to the intranet, and then you want to click on imed, and when you do that, you'll come to this page. Oh, sorry. Username is SODA, which stands for Surgery ODA, and then the password is Rancho. Click on Login, and then this page will come up. You want to look under Favorites and Consents, and then pick out the one you want. Also pick out a language. This needs to be done before you pick out the type of consent that you want. And these are in alphabetical order, so you just need to scroll down. I'm doing one that's a ray resection as an example. So I picked this toe ray resection, and then you click Start. And then which version you want, the library version, and then click OK. And then on this drop-down menu, Rancho Los Amigos is the next to the last one, so you click on that. You want to put in the patient's name. I like to use all caps and do it last name, first name. That's the way it's going to show up in the patient identification area. Put in their medical record number using this format that's used throughout the county. Put in their birthday using the month, day, and the 4 characters for the year. Provider of record is Richard Chambers, and his provider number is 010110. So it's very simple. And then you can, for the performing provider, you can put in Dr. Chambers' name and your name and anyone else's name that you like, or you can just leave it with Dr. Chambers' name. I used to put my name in there when I used to help out with surgery. And then this is what's going to come up that's already in the library, and so you need to modify this a bit to make it more specific for the particular situation for the patient. And also this anatomical specification box needs to be modified to identify what it is that's going to be removed. So this consent is for a first and second ray resection. So these things that are highlighted in yellow are the things that I added, and I have them in full caps so that you can see that I added them. So it'll be removal of the right first toe and possibly all or part of the corresponding metatarsal bone, and possibly the second toe and all or part of the corresponding metatarsal. And then here I put what it is that's infected that we're going to be removing. So in this case, it was a right first toe infection. Remember, this is for the patient, so you want to make it simple. This is already pre-populated, these areas here. The ones with the red are the ones that you need to fill in. As you know, I know you've done this before. So will providers other than the operating practitioner be in the surgery? Click off no. Will an observer be present? Click off no. Um, and then for will an observer be present? Type in not applicable. Is there a reasonable probability that a blood transfusion may be necessary? It's yes for everybody. Will an interpreter be used? Pick one. No, yes, or you're going to do the interpretation. And then click off no for telephone consent and for treatment without consent. So I'm going to stop there and I'll pick up with my next segment.